Hello and welcome to the HIPAA Vault podcast with Adam and Gil. My name's Adam Zeineddine. I'm your co-host today, and I'm joined by Gil Vidals. Hey, Gil.
Hey, Adam. Yeah, I'm Gil Vidals, CTO and founder of HIPAA Vault. So glad and excited to get our first episode off the ground.
Yeah, awesome. Our first episode. What I'd like to do today is maybe give some introductions about who we are, what we do, and what can listeners expect from the podcast moving forward. Does that sound good?
Yeah, let's do it.
Okay, so HIPAA Vault's a managed security service provider, and we've been in the space for a while. Could you tell us a little bit, as CTO and founder, about the origins of HIPAA Vault, how it came about, maybe a little bit about your background as well?
Sure. I'd love to do that. So again, my name's Gil Vidals, and HIPAA Vault is a company I founded many years ago in 1997. Now, it didn't start off as HIPAA Vault. I was selling domains. And back in the day, the question at that time was, should I start a business on the internet? And some people are like, time out, what's the internet? And some people were saying, time out, what if that's just a fad? What if it's not?
And you knew you were onto something there.
Well, I was scared because I thought, what if these people are right? I mean, what if the internet's not something, that's going to be popular? And at that time, it was actually illegal to do commerce on the internet. It was only the government and the military that could do that. The internet was not set up for commerce. It was set up for transacting documents, and it was really by DARPA. That was a defense project and so on. Of course, e-commerce came along pretty quickly, and you didn't get in trouble if you did commerce, but you weren't supposed to. But I started back then, and it wasn't making any real money until one day someone says, "Hey, can you sell me a domain?" And then I thought, oh, there's going to be some money involved here. This is a good thing. And over the years, I got into hosting and search engine optimization, but it wasn't until 2012 or so that one of my customers said to me, do you know anything about hosting medical data? Because they had a project where they wanted to introduce patient health information. And I told them, honestly, I didn't know a HIPAA from a hippo. And they liked what we did, so they decided to go ahead and give me that opportunity. And I'm glad, because at that time, Adam, it was a race to the bottom. By that I mean those that had the cheapest, lowest price won. And you don't want to be in any industry where you're just, by virtue of being the cheapest, you're in business, because that means your profit margins are razor thin, and it's not really a good business model.
So were you up against hosting providers like GoDaddy and the likes?
No, not at that time. There weren't big names like that. Everybody was just getting started. I think the big one back then, or one of the first ones that had name recognition, was called Simply Net. And they did really well. They sold to GeoCities. But what I realized that it was all about pricing. And one of my customers said, hey, why should I pay you, $200 a month for a dedicated server? Because this is all rack and stack. When I can go over here at this competitor and pay, half as much, $100 a month. I knew that something just wasn't right. This was all about just the cheapest game in town. So I pivoted away from that, went to the HIPAA focus for hosting and protecting health information in the cloud. And I think that was a good decision at the time. Now that I look back, I was really happy I did that, because now we're servicing clients that know it's valuable what we do for them. It's not just about what's cheap. It's about really what's secure and giving good service to them.
And what goes into that in general? Like, why is healthcare a pretty tricky industry when it comes to technology and security around technology?
Well, healthcare records are protected by the HIPAA and HITRUST regulations, so that puts more pressure on the technology where you have to secure it. Now, if you don't have sensitive data, let's just say you have a brochure website that just has pretty pictures, but there's no e-commerce, it's just a brochureware, then if somebody were to break in, there's nothing to take. Everything's publicly available, all the pictures, everything. So there's no liability there. But as soon as you have patient records, there's liability. If those records are taken, then the patient can come after you, and there could be a lawsuit because of that. So the liability causes a lot of angst, and it really builds the pressure up to have to secure that data and do a good job of it.
So if the website is just a homepage and about us, and maybe here's the services we provide, then there's no patient information to secure. But as soon as you start getting things like contact forms where patients are going to be submitting information and that's stored in the database, then the warning signs should start flashing, right?
Yeah, that's exactly right. And the audience, this is good for the audience to know, because our audience are healthcare developers, healthcare app developers, and medical practitioners. So if you're a medical practitioner and you have a beautiful website, I'm not taking anything away from the site, might be very professional, may have been expensive to develop it and all of that, could have videos, lots of pictures, all of that stuff's great. You don't need to worry about HIPAA compliance if there's no transactions happening on the site. There's no patients that are logging in, there's no forms that they're filling out. Now, there could be a basic contact form, but we're talking about a form that would be more about asking, well, what's your condition?
Symptoms, yeah,
that kind of a thing. So I would let our audience know that if there is no sensitive data, all that means is they could leave the site up and do some kind of security review, but it's not as intense as if it had sensitive data.
Yeah, and just on that point, podcast@HIPAAvault.com is a good email address to reach us at if you do have any questions about securing that healthcare information. Maybe you have a website, you're not quite sure whether HIPAA applies to it, then you can reach out to us at podcast@HIPAAvault.com. And you never know, you might get one of the questions on a future episode, and we'll answer it. Okay, so that's a nice introduction to HIPAA Vault. What aspects, if we look at today, what aspects of security are particular notes that web developers and healthcare companies need to pay attention to when it comes to locking them down and securing them for patients' information?
Yeah, what comes to mind are a couple of things. One would be the data has to be encrypted, and that's something that I think our audience in general should know about this. So encryption means that you take data that's legible, plain text data, and it's essentially scrambled with a security key. So when you look at it, it's nonsensical. Only if you have the key can you unlock the code and read it. That's encryption. Well, there's encryption at 3 different levels. If the data, when the system is powered off, the computer is powered off, that's at rest. And then there's encryption in transport. That's when the data is being sent from point A to point B. So let's say you're on a web page, you're actually pulling data. You don't think about it that way. You just see the screen, oh, there's the data, but it's coming from somewhere. So that connection has to be encrypted. That's in transit. And then there's one in use that you don't hear about a lot. So what that means is that the database where the information is, that could also be encrypted. So that's called data or encryption in use. So it's only decrypted the moment that it's needed. As soon as it's not needed anymore, it's put back in an encrypted format. So the audience should be aware of that kind of encryption at 3 different levels, and whoever they talk to, whoever you're working with to provide your technology and your application, you should ask them and say, hey, are you encrypting my data in all 3? And it's not very common, by the way, to have the data encrypted in use. 90% of what I see, the databases are not encrypted. In other words, the data is plain format there. And HIPAA does not require that it is encrypted in use. It's required that it's be encrypted in general. So HIPAA is kind of a loose guideline. They just say have encryption, but they don't say, okay, does it have to be in use as well? And most 99.9% of people have it encrypted through HTTPS. If you notice when you go to a website, you always type HTTPS. So that handle
padlock.
Right.
to
It
the
has the
URL,
padlock. Right. So that's kind of a no-brainer in terms of encryption, that one. And then at rest, usually systems in the public cloud, when I say systems, I mean the virtual machines, are usually encrypted when the virtual machine is powered off. So that handles that one. But the middle one in use is the one that people kind of stump people like, well, what do you mean? Well, talk to your developer and ask them, say, hey, when you have my data in the database, is it encrypted in the database? So that's something to think about. And if it is, then that's a good thing to have. The other thing I was going to mention, Adam, is really important, is when you're shopping around and you're looking, where do I put my medical website? If you're a healthcare app developer, where do I want to host my customers' applications? And when you're shopping around, ask one question that I think will be very telling, and that is, say, hey, I'd like to have a meeting or know the name of your compliance manager. And that's important because the compliance manager is the one that's typically in charge of scanning your website to make sure that there aren't any high critical vulnerabilities. That's his job. And then if he finds one, he assigns it to an engineer. So what could happen is this: you ask the question, and then the guy on the other end might say, compliance manager, well, we don't have one of those. That's a red flag. Or he might say, well, we have a compliance manager, but he's not available to talk to you. It's like, well, why not? If he's going to protect my data, I'd like to talk to this guy. And by the way, if they say they don't, if he's too busy, maybe they don't actually have one. So that's kind of a clue. So you really want to ask that question. That's a really good question to ask. That's a very encompassing question. It means that they're well organized. They have someone in charge of that. So it has a lot of insinuation by asking that question.
Okay, so encryption, compliance manager. What about users? Is there any kind of security around users and access that we should consider?
Sure. Sure. Yeah, you have to be careful with, you want to restrict the users to the back end. That back end is a common term used in technology to mean the non-public facing side of your website. So the public facing, obviously that's the public. Anyone who has a laptop can hit your website. But the back end means the developers, the engineers, the support staff, they come in through the back door to make changes to the website or to the programming. So you want to make sure that the back end is well protected, and you don't want to let people in there unless you know who they are. If it's somebody working on your site, you know who they are, then you give them access to that. And they really should be using some kind of two-factor authentication to access your database, the back end. All of that needs to be protected with two-factor authentication.
Two-factor authentication. So my understanding of that is you're trying to reduce the likelihood, of people sharing passwords and logins, right? Is that about right?
I think that's true, what you said. That is true, but that's more of a secondary benefit. The real benefit there is when someone logs in, they have to provide a password, just the normal username password, but then there's a 6-digit token. It's typically a 6-digit token that's sent to a phone, or it's sent via email. Sometimes it's like a Google Authenticator where you have the app that's every 60 seconds, it produces a new string of numbers. And that's even better. So what that's doing is essentially, as we all know, unfortunately, the bad guys can steal credentials, and they do steal them all the time. So let's say a bad guy steals your username and password. Well, when they use that, then they gets the prompt saying, hey, look at your phone and give me that token, that 6-digit code that's on your phone. Well, they don't have your phone. So they're done. They can't get through. So that
if they do have your phone, you already know something's wrong, right?
Yeah. If you lost your phone and your credit cards, you're going to deal with that. You would call your phone carrier, or you would call your boss and say, hey, I lost my phone, and they can wipe your phone remotely, and you'd have to deal with that.
Okay. Yeah. So encryption, compliance manager, and two-factor authentication. Yeah,
those are some of the high-level things. And I know you and I discussed, well, what's the goal of our podcast? And I'd like to share with the audience that what we really want to do is talk about all things HIPAA, and in particular, we're very interested and we want to lean into what WordPress, because WordPress hosts a really high number of websites that are at least in the US, and I say worldwide. I think the statistics are something like 43%
I think
of
it's
the
higher
websites.
now.
Oh, it's higher. Okay, so it's
close
big.
to 50%.
Okay, so that's why our bent is going to be toward HIPAA compliance in terms of the WordPress ecosystem. So we're going to be talking about things like plugins, which plugins may have some special benefit. We're going to be talking about the WordPress core and updating it, and essentially protecting that from a HIPAA standpoint. And I'm really excited to do that with our audience. I'd like to talk about practical things, Adam, that they could take away. They can actually do something, not just, we're talking heads and it's just high level, but we want to come down with some real nuts and bolts where they could say, hey, I got something valuable. And even in this podcast, we talked about, well, if you're shopping, what's a good question to ask on the other end? Well, do you have a compliance manager? I mean, that's a great question. That'll really help you make your decision as to where to host your valuable content.
Definitely. And I'm sure the audience will look forward to us going a little bit deeper into WordPress specifically, because like you said, it is a very, very popular way to manage websites. Okay, well, I think that's all for the intro episode. Be sure to check us out on HIPAAVault.com for latest news. You can reach out to us on podcast@HIPAAVault.com. And until next time, thanks for stopping by.
Thank you, everybody.